Hello everyone, my name is Dr. Simone Atkinson and today we are covering pneumonia. Let's get to the point. Pneumonia is characterized by the acute inflammation of lung parenchyma, including alveoli and respiratory bronchioles. It is categorized based on viral or bacterial origins, acquisition settings such as community or healthcare facility, and specific types like atypical, aspiration, or pneumocystis pneumonia. The causative agent encompass infectious factors such as bacteria, viruses, fungi, and other microbes, as well as non-infectious sources like aspiration or inhaled substances. The presence of microbes within the alveoli triggers both inflammatory and immune responses. The interaction between antigens and antibodies leads to the harm of mucous membranes in bronchioles and alveoli, leading to edema. Alveoli become filled with microbes, cellular debris, and exudate, potentially disrupting gas exchange. So in the process of assessment, various indicators come into play. Fever, which is typically of low grade in viral infections, is more pronounced in bacterial cases, and they might be accompanied by chills. A cough marked by sputum production along with audible rhonchi and wheezes during chest examination also contributes to the diagnostic picture. Episodic chest pain and potential dyspnea, possibly requiring the utilization of accessory muscles for breathing. These further underscore the condition's complexity. And it's important to note that mental status changes can emerge if hypoxemia becomes significant. Moreover, an elevated white blood cell count, particularly elevated in bacterial infections compared to viral ones, adds valuable diagnostic insight, and visualizing the affected lung regions is made possible through chest X-ray, which facilitates a comprehensive assessment. Collaborative management involves several key components, including the maintenance of a patent airway and continuous monitoring of respiratory and oxygen status in these clients, and the head of the bed is elevated to alleviate respiratory strain, while prescribed oxygen is administered to address hypoxia. Pulmonary hygiene measures such as coughing and deep breathing and repositioning are provided, along with incentive spirometer for respiratory exercises. Now, additionally, the client is offered small, frequent meals with high-calorie, high-protein foods, taking into consideration the challenge of simultaneous breathing and eating. Fluid intake is encouraged up to 3 liters per day if there are no contraindications. This is aimed at reducing the viscosity of sputum. An adequate physical rest is also ensured as part of the collaborative management approach. When addressing the needs of hospitalized clients, it is essential to apply preventive strategies to mitigate the risk of pneumonia. So these strategies encompass encouraging ambulation and mobility, following infection control procedures such as meticulous hand hygiene and appropriate disposal of expelled secretions, and initiating precautionary measures for individuals identified as being at risk. Furthermore, medication therapy encompasses the utilization of antibiotics or other pertinent anti-infectives, along with the administration of analgesics and antipyretics when required. Finally, in terms of client education, it is important to emphasize several key aspects: the significance of immunization against influenza and pneumococcal pneumonia, the importance of adhering to activity limitations and prioritizing rest for effective healing, understanding the potential effects and the proper dosages of medications, and the need to avoid pollutants and irritants like smoke, and the awareness to promptly report symptoms such as a return of fever or worsening respiratory status. Okay, you are now armed again with the information, most salient points for pneumonia. If you found this information helpful, please give the video a thumbs up and subscribe to the channel. See you in the next video.